Hello friends, in this particular video I'll be talking about the leaking incisions. Now this is a case I'm operating on topical anesthesia, and as you can see, during making of the side port incision the patient made inadvertent eye movement and the side port was created much larger than what I was aiming for, and obviously as we know that this can lead to a lot of wound leakage. So in this video, I will not talk about just about this case, but in general, how to manage the wound leak. Now the major problem with the large incision, which is larger than expected, is that there will be continuously outflow of the fluid during the procedure, and which makes the anterior chamber quite unstable. And if you go through the phaco-dynamics, you will understand wound leak is the one thing which even the best of the machines cannot tackle on its own, even having the IOP control mechanism. So in this case, there are two options. I can suture the wound and make another small side incision and go ahead with the surgery just as usual. But I would like to show you here that once I entered through the side port, you can see the amount of fluid which starts leaking from this incision. Once this kind of leak starts, if you are using low vacuum, then it is fine because still there will not be much of a surge or fluctuation in the antechamber. So I decided that I will just do 4 quadrants using the sculpting because I am using low vacuum. The moment I shift to high vacuum for removal of these chopped or the divided pieces, you will immediately find the AC starts fluctuating and it will become riskier for the last piece if I am using a very high vacuum with this kind of wound leak. If you see your own videos, sometimes you will find this kind of wound leak you are not actually observing, but it is there and causing a lot of fluctuation in the antechamber and the surge. So for the last piece, I decided that I will just take out my Sinski hook. So the wound kind of closes, though there is a little leak which is going on, but the amount of leak has reduced. And you can see that immediately the chamber has become much more stable and there are no fluctuation of the posterior capsule. So it is important to look into this matter when you start the surgery. If any of the incision is leaking, you have to tackle it first. Based on the case and the size of the incision, either you can suture the incision and make a new small incision. If it is the main incision which you have inadvertently made large, you may have to shift your position from say temporal to superior and make another incision there after suturing the main incision. As you can see here that once I stop using the side port incision, the AC becomes much more stable. So during your routine surgeries, always keep in mind if the wound leak is high or not. This will help you in reducing complications in many of the cases. Uh, because wound leak is one of the cause of surge in even with the best of the machines and can cause increased chances of PC rate. Thank you.